Lab 5, Flexibility. Alright, for a quick overview, we're going to be going over the Canadian trunk forward flexion test, YMCA sit and reach test, chair sit and reach test, and also the Thomas test. Like with anything else, when you're testing, you would want to start off with a 5-minute aerobic warm-up, and this is shown in the video. Now, when you come back from your jog, you would go back and just start stretching, which would be dynamic stretching, and then that would just help loosen up and warm up your hip extensors, flexors, as well as your hamstrings in order to assess them in the test. So we're going to start off with the Canadian trunk forward flexion test, and that basically assesses your hamstrings and lower back flexibility. Alright, so you want to make sure you remove your shoes and your feet are intact with the box and your knees are not bent. Now when you reach forward, you should be exhaling and you should hold it for 2 seconds, and the leading hand should be over the other, and that would classify as not leading with the other hand. To properly score the Canadian trunk forward flexion test, you would calculate it in centimeters, which is on the actual box, and you would repeat the assessment and then take the better one. And then when you want to assess the scores, you would categorize them by deducting 3 and then finding it on the table. So as an example, I'm going to be using myself. So I'm female, it's 21, so I would go through this stage right here. And then my original score is 28, but when you subtract 3, so that would be 25, which would be, my category would be needs improvement. Now for the YMCA sit and reach test, you would want to remove your shoes, place the yardstick on the floor, place a strip on tape on the 15-inch mark, and your feet should be at least 10 to 12 inches apart. Be exhaling while you're going forward, and then your fingers must be one on top of the other, and you should hold it for 2 seconds. Now, in order to classify the YMCA sit and reach test, you would score it in inches, and then you should repeat the assessment at least twice and take the best of the 2 scores, and then you would categorize it. Again, as an example, I'm using myself. So I'm a 21-year-old woman, so I'd be using that category right here. So mine was 16, which is categorized as well below average. Alright, so now we're going to be going with the chair sit and reach test. This test is for older populations, and it would require you to use a chair that's 17 inches in height and should be placed against a wall or something sturdy. You also need a partner to hold the ruler, and they would just measure the distance from your toe to your fingertips. Also keep your untested leg flat on the floor, and remember to keep your head in normal alignment. Alright, so you don't have to remove your shoes. So you would just put your foot in dorsiflexion and then just reach as far as you can. And then remember to exhale, and then they will just measure from your toe to the tip of your finger. Then you would continue on to your other foot, and remember to keep the untested foot planted on the floor, and your head should be normally aligned with your body. Okay, so in order to score the chair sit and reach, you should know that it's scored in inches, and then you would just measure the distance from the toe to the fingertips, and if there's space between it and it's before the toes, it's going to be negative, and then if the toe is touching with your fingertips, it's going to be a 0, and then fingertips passing the toe would be a positive score. Now for the Thomas test. For the Thomas test, it's a hip flexor flexibility assessment. So it requires you to lay supine and then just bring your knee to your chest, and then if your leg doesn't move, then it would mean that you're flexible. Now you switch to the other side, and then you would do the same thing. And you could do it with or without shoes, and then the second person would classify you as inflexible or flexible, determining on if the leg was raised or not. And that concludes Lab 5, which is assessing flexibility.